Angina is chest pain or discomfort caused by reduced blood flow to the heart muscle. Like any engine, your heart needs a steady supply of fuel and oxygen to function correctly. This vital supply is delivered through your coronary arteries, the blood vessels that wrap around your heart. When these arteries become narrowed or blocked, the flow of oxygen-rich blood to your heart muscle is compromised, leading to a condition known as angina. This reduced blood flow essentially starves your heart of the oxygen it desperately needs, especially during times of increased demand, such as during physical activity or emotional stress. While angina is a serious condition and a warning sign of underlying heart disease, it's important to remember that it is not a heart attack. However, it's a clear signal that your heart is not receiving the adequate blood flow it needs, and this should never be ignored. It is generally categorized into three main types: stable angina, unstable angina, and variant angina. Each type has its own unique characteristics and implications for your heart health. Stable angina is the most common type, often triggered by physical exertion or emotional stress, and typically follows a predictable pattern. The pain usually subsides with rest or medication. Unstable angina is more unpredictable and dangerous, occurring even at rest and often more severe. It signals worsening coronary artery disease and requires immediate medical attention. Variant angina, or Prinzmetal's angina, is less common and caused by a temporary spasm of the coronary arteries. This type can occur at any time and is often triggered by smoking, cold temperatures, or certain medications. Understanding the different types of angina is crucial for proper diagnosis and treatment. Recognizing the symptoms of angina is paramount for early intervention. The most common description of angina pain is a feeling of tightness, pressure, squeezing, or heaviness in the chest. The pain may also radiate to other parts of the body, including the arms, shoulders, neck, jaw, back, or even the teeth. In addition to chest pain, angina can also present with symptoms like shortness of breath, nausea, sweating, dizziness, or lightheadedness. It's important to note that not everyone experiences all these symptoms, and the intensity and duration can vary significantly. An angina is a consequence of inadequate blood flow to the heart muscle, primarily caused by the narrowing or blockage of the coronary arteries. Imagine your coronary arteries as a network of pipes supplying vital nutrients and oxygen to your heart. Over time, a buildup of fatty deposits, cholesterol, calcium, and other substances, known as plaque, can accumulate on the inner walls of these arteries. This process, known as atherosclerosis, gradually narrows the arteries, restricting blood flow and reducing the heart's oxygen supply. When the heart muscle is starved of oxygen, it sends out distress signals in the form of pain, which we perceive as angina. A mild blockage might only cause symptoms during strenuous activity, while a more severe blockage can trigger symptoms even at rest. By adopting a heart-healthy lifestyle, controlling risk factors, and adhering to medical advice, you can take proactive steps to slow or even reverse the progression of this condition. While anyone can potentially experience angina, certain factors can significantly increase your risk. These risk factors can be categorized as either modifiable or non-modifiable. Modifiable risk factors include smoking, high blood pressure, high cholesterol, diabetes, obesity, physical inactivity, and an unhealthy diet. Smoking damages your blood vessels and increases your risk of plaque buildup. High blood pressure puts added strain on your heart and arteries, while high cholesterol contributes to plaque formation. Diabetes can damage your blood vessels over time, and obesity puts you at a higher risk for other conditions. Physical inactivity and an unhealthy diet also contribute to various risk factors. Non-modifiable risk factors include age, gender, and family history. As you age, your risk of developing heart disease naturally increases, and a family history of heart disease also puts you at an elevated risk. It is a serious condition that should never be ignored. While not every instance of chest pain signifies a heart attack, it's crucial to err on the side of caution and seek immediate medical attention if you experience any of the following. Sudden, new chest pain. If you've never experienced angina before and suddenly develop chest pain, especially if it's severe or accompanied by other symptoms like shortness of breath, sweating, or nausea, call 911 or your local emergency number immediately. Worsening angina. If your usual angina symptoms change, become more frequent, last longer, or are not relieved by rest or medication, seek immediate medical attention. Angina at rest. If you experience angina while resting or doing minimal activity, it could be a sign of unstable angina, which requires urgent medical care. The sooner you receive medical attention, the better the chances of limiting any potential damage to your heart. It's always better to be safe than sorry, so don't hesitate to call for help if you suspect something is wrong. Diagnosing angina typically involves a combination of a thorough medical history, physical examination, and various diagnostic tests. Your doctor will inquire about your symptoms, their frequency, duration, and potential triggers. They will also perform a physical exam, listening to your heart and lungs for any abnormalities. Electrocardiogram, or EKG, is a common test used to measure your heart's electrical activity and can reveal any abnormalities in heart rhythm or signs of a previous heart attack. Stress tests are often conducted to monitor your heart's response to exertion. During a stress test, you'll be asked to walk on a treadmill or pedal a stationary bike while your heart rate, blood pressure, and EKG are monitored. Coronary angiography, also known as cardiac catheterization, is a more invasive procedure that involves threading a thin tube through an artery to your heart, allowing doctors to inject a special dye that makes your coronary arteries visible on X-ray. Treating angina effectively involves a multi-pronged approach that addresses both the symptoms and the underlying cause, coronary artery disease. Treatment plans are highly individualized, tailored to your specific needs, medical history, and the severity of your condition. Medications play a crucial role in managing angina symptoms and reducing your risk of complications. Your doctor may prescribe various medications, including nitrates to relax and widen your blood vessels, aspirin to prevent blood clots, beta blockers to slow your heart rate and lower blood pressure, and statins to lower your cholesterol levels. In some cases, procedures like angioplasty or coronary artery bypass surgery may be necessary to improve blood flow to your heart. Angioplasty involves threading a catheter with a balloon at its tip to the narrowed artery. The balloon is then inflated to open up the artery, and a stent, a small mesh tube, may be implanted to keep it open. Lifestyle changes are equally important in managing angina and preventing future episodes, including quitting smoking, eating a heart-healthy diet, exercising regularly, maintaining a healthy weight, managing stress, and taking your medications as prescribed. Angina is a warning sign from your body that your heart is not receiving the adequate blood flow it needs to function optimally. Recognizing the symptoms early and seeking prompt medical attention is crucial for preventing potentially life-threatening complications, such as a heart attack. Early detection allows for timely intervention and management, which can significantly improve your long-term health outcomes. By working closely with your healthcare provider, following their recommendations, and adopting a heart-healthy lifestyle, you can effectively manage angina and live a longer, healthier life. By understanding angina, its causes, and the importance of early detection and management, you empower yourself to make informed decisions that contribute to a healthier, more vibrant life.